Ladies and gentlemen, delighted to have you join us today. And this session is going to address mentoring and what mentoring is, how we should be considering carrying it out, and what the relevance of mentoring is in today's society, particularly when you are working in an area where medicine is integrating with digital health. And I'm going to share this presentation with Alex Harkins, who is a GP from London, and she'll introduce herself when she speaks, and David Wright, who has been one of these dreadful people called administrators. And David's going to explain a little bit about what he has administrated before in Australia. So what is mentoring? According to the Oxford Languages Dictionary, and that's the one used by Google, mentoring means to advise or train someone, especially a younger colleague. Now, there are many definitions for mentoring, and it's often confused with training and remedial support. And it's not actually either of these. For the purposes of this presentation, mentoring is a process whereby an experienced, highly regarded, empathetic person guides another individual in the development and re-examination of their own ideas, their learning and personal and professional development. Usually the mentor works in the same organization, but they don't need to. And this is achieved by listening and talking in confidence to the mentee. Anybody can become a mentor. And in this system that we have at present, some of our younger doctors working in healthcare are actually more experienced at digital health than some of their more senior colleagues. So you can be a mentor, even although you're relatively junior, if we are looking at improving and helping people get through the hurdles of improving their digital skills. The main purpose of mentoring is to help you or your mentees develop skills and attributes that will enable them to perform to the best of their ability. Mentors must consider their mentee as an individual with interests and aspirations both inside and outside the workplace. And mentoring discussions should center on work-life balance as well as the work that people are doing. And it can be beneficial at any stage in a professional's career and should not be associated with crisis points. Health and care professionals should seek a mentor to improve their general skills and understanding of their performance and position, particularly within a particular context. So, what is the difference between coaching and mentoring? Many people believe these terms are synonymous, but they are very distinct. Before you seek out a mentor or become a mentor yourself, you should be clear on what the differences between the two are, so that you can form the most appropriate type of relationship between both parties. Coaching is a short-term, time-limited process, whereas mentoring tends to occur over a prolonged period. It's usually long-term and development-focused. In other words, your mentee comes to the mentor and says, "Can you help me? I want to improve in these areas. and I'd be very grateful for your help. The mentor is typically somebody more senior and more experienced, but they don't have to be. And it is important that the meetings are informal, with the agenda set by the mentee and not the mentor. In other words, the mentee contacts the mentor and says, can we have a meeting? I'd like to discuss A, B, and C. These will be discussed at the meeting, but of course the discussion is likely to move to other areas. Just as it's crucial to distinguish the mentoring from coaching, it's equally important to note that mentoring is not counselling, patronage, or merely giving advice. There are many types of support, particularly within medicine, and these are described here: sponsorship, preceptorship, teaching, having a teacher, an educational supervisor, clinical supervisor, etc. At the bottom right, you have the remedial trainer. That is the person that has offered to help you get through a particularly difficult point in your career. Mentoring is done voluntarily, and it's done because the mentee identifies somebody that they think can help them, and the mentor must consider, before they take on a mentee, whether it's appropriate for them to do so and how they might do it. And that needs to be spelt out at the beginning. The mentor and mentee must agree the boundaries of the relationship between them and identify defined goals and outcomes. It is a time commitment on both sides, and the times you're prepared to devote to mentoring need to be clearly identified quite early on. Obviously, for clinicians, it's difficult for them to do mentoring during the working day. It will tend to be more in the evening, but it is possible to organise half days for meeting when the half days are free on both sides. The mentee should set the agenda, with the mentor responding to this rather than imposing their own views. You've got to support the digital health professional in their personal and professional development. Help them develop leadership skills. Support the development of future career paths. Improve confidence in their ability to deal with difficult situations and challenging communications with colleagues and patients. You should provide an impartial and informed outsider view who understands the context but is not directly involved. And it is helpful for the mentor not to be part of the organisation that the mentee is working in some situations. And we should be aiming to improve working environments and ultimately improve patient care. So, at this stage, I'd like to pass over to Alex, who's going to talk us through the remainder of the points, and then David is going to join us later. Alex, can you take over at this point and tell us about the mentee and the mentor?
Thank you, Angus. So I'm Alexandra Harkins. My background's in general practice, and my most recent role was as a responsible officer to a large designated body of doctors in London, but the doctors are based across the country. And so obviously I had oversight of appraisals, appraisal, as Angus said, is obviously different from mentoring, but there are some aspects that overlap, but it's very different. But for thinking about individuals' development through mentoring is an area that I'm really interested in. So in terms of the benefits of mentoring to the mentor, I think both sides really gain from it. Angus has mentioned the benefits to the mentee, but to the mentor, it really gives them an opportunity to reflect on their own attitudes and behaviours and consider them in light of the mentee's experiences. And it can help the mentor develop their own communication skills that are important to them for their leadership roles, such as active listening, insightful questioning, clarifying points, and checking mutual understanding. So it can help their own development. And I think there's personal sort of altruistic reasons that people are often mentors. It provides them with personal satisfaction that they're actually helping develop someone else's skills, utilising their expertise. And I think that, as Angus has mentioned, being removed from the organisation in some situations can be really helpful to give a broader perspective rather than someone who's sort of entwined in a situation. And so in terms of the benefits to the organisation, there are many. I think workplace culture is absolutely key for patient safety. A functioning organisation culturally will facilitate high quality patient care. And so an organisation that accepts mentoring as a normal way of working will really help reflective practice, because reflective practice is how we all learn, how we all develop, how we all improve in every area. And I think in this digitally changing world, it's really important that digital health professionals are constantly reflecting on their practice and how they're working collaboratively in teams. I think mentoring can help the organisation to function well culturally and to prevent communication difficulties or little issues worsening into problems that can have negative impacts on team working. And that can have, disastrous effects on the running of the organisation, which actually ultimately, in fact, impacts on patient care. Mentoring can widen skill bases and competencies of staff in line with the strategic goals of the organisation. And I think succession planning is another important benefit to the organisation, because through mentoring, senior leaders can identify or juniors or help grow juniors to help shape them for the skills that they'll need, broader than medical skills, those wider leadership skills, those skills about communication, leadership. And also mentees can see that there's a future for them, there's a career progression for them as well, learning those wider skills outside of just medicine. And I think it can increase morale and job satisfaction for both sides.
I'd like to hand over to David now, who's going to take us through the next couple of slides. David, can you introduce yourself after you've unmuted, and can you take us through the next two slides, focusing a little bit more on industry and how we can provide mentorship for industry, please.
Thanks, Angus. You introduced me as an administrator just now, which I thought was very interesting. Given my background over the years, you mentioned that a little bit about Australia. I left England in 1982. I was a teacher. I had a mentor then that I could refer to, somebody that in my educational environment when I was teaching, and I taught in London for about 4 years before going to Australia. And I was playing serious sport at the time when I went. And I actually took on another mentor during my sporting career. And then as I developed into business, I had a further mentor who I could refer to and bounce ideas off and so on. It's been very influential in my life, so I can highly recommend it. And that's one of the reasons that I'm very keen on getting behind a mentorship program for UKDHC. Now, for those of you listening, UKDHC is digital health and care. And I'm very keen on the whole journey of healthcare. So it's social care as well as tertiary care. It's the whole journey and the spectrum. There's 1.3 million people working in the NHS in the UK, and there's a similar number working in social care, and they're all using digital skills, or some are trying to. But all the research has shown that no matter what programs we have in front of them, it's the training, the education, the usage, the practice, and so on that goes along. I'm a great believer in see one, do one, teach one, which to me underpins medical education. Now, my background, as Angus said, as an administrator, I was chief executive of the Royal College of GPs in Australia. I managed to be part of a team that grew the membership from about 9,000 to its present state now, which is about 42,000. And it was all about collegiality, working together, common aims, advocacy, education, training. And I'm a great believer in that. And I want to do that with UKDHC, be a provider of education. And in this mentorship program, Q4, which we're in the middle of now, that's what I'm doing now, is growing the membership, both individual and corporate. So any listeners on this program, if you want to become a member or you're interested in mentorship, there'll be information coming out in the new year in Q1. Next, please, Angus. And that's what we're going to do. We're going to plan a database of skills and guidelines for the program to develop a framework. And then we're going to create mentorships and start joining the dots on people that want to have a mentor or be a mentee. And this is all about learning, and then growing the reach, expanding the number of mentorships in place, and then doing evaluations. This is a very personal, confidential environment that we have. I'm currently mentoring 3 very, very senior chief executives back into Australia. It's been a wonderful experience for me to rely on some of the mistakes that I've made along my career to pass on ideas, options, and so on, and learn along the way. And I'm learning from these people as well. So the benefits that we're going to put together for SMEs as well, because we want to provide the opportunities for SMEs to be involved, because as we all know, whether you're in a startup or you're growing your own business, you have problems with regulations. Now, I know from the current membership of UKDHC, in fact, on the board and the executive committee, there are some very, very highly skilled, intelligent, well-networked individuals who are supporting UKDHC. They are a wealth of knowledge to tap into. We all have HR issues, bouncing ideas. And I've always believed that managing staff is often the hardest job for any manager, acting as a sounding board on options. That's one of the things I'm dealing with at the moment with one of my mentees back in Australia. It's dealing with staff issues and just bouncing off ideas, and also the business issues, the environment that we're all working in. We have to bounce ideas off business growth, when to put the sales up, when to grow, when to stay static, the tax implications and so on. There's lots of other ideas, but I just know that the people involved in UKDHC so far, and I'd like to grow that membership, that there's an opportunity for learnings along the way. And as UKDHC grows its foundations, there will be opportunities to learn from, as well as pass on information and networking opportunities. Thanks, Angus.
Thank you, David. I'd now like to pass the baton back to Alex, who's going to take us through this concluding slide. Alex.
So where do we see the UKDHC as how will it be the home for mentoring for health and digital care professionals? It's going to enable really personalised developmental support through mentoring. And I think the key word there is it's personalised, it's individual. Through David, we've seen the different aspects that people might choose to have mentorship on, and we can find people with that right expertise to supportively, that's another key word there. Mentorship is supportive, it's developmental. And it's, all professionals should be constantly seeking to develop their practice, both clinically and those wider, softer leadership, developmental communication skills. And I think we're all facing a rapid pace of change in healthcare organisations with digital tech evolving. Not just clinical changes, but the tech side, but also cultures change, organizations change, management structures change, and all of those changes, require, time to reflect on what's happening, how to navigate that path forwards in the best possible way. And mentorship is really helpful in helping us to do that. And so UKDHC advocates mentoring at all stages. Good medical practice, the GMC's framework of standards for doctors, actually refers to mentorship specifically, and it particularly requires doctors to take responsibility to act as a mentor to less experienced colleagues and to seek a mentor to improve their own skills. Point 12 in good medical practice says when you join an organisation or when your role changes significantly throughout your career, you should be willing to find and take part in structured support opportunities offered by your employer or contracting body, such as mentoring or coaching schemes. So the GMC clearly recognised that value of ongoing support to help us all develop and move forwards. And the GMC has a really interesting mentoring toolkit page on its website with some guidance, and it has a section on possible barriers to it, ways to overcome them, some strategies, some solutions. Quite interesting read, so you might want to take a look at that. And I'll hand back to Angus.
Thank you, Alex. And now we're going to have a discussion about some of the things we have talked about. We're happy to take questions from our audience. David, I was teasing a little bit when I used the word administrator. I'm sure you realize that. In the NHS, the word administrator has become a sort of negative thing. And yet, as I have matured, I have realized that actually running the organizations is as difficult a challenge as looking after patients. And we need to respect and work collaboratively with those managers. For instance, one of the sessions I did previously was with Will Monaghan, who was a business manager, and I worked very collaboratively with him. But I have come to realize that our administrators and managers are having challenges at the moment, which I don't think I would want to have. David, do you want to talk about that in the current climate?
Oh, for sure. One of my favorite jobs when I was running the RACGP, the College of General Practice, was getting to know other staff. And one day a month, I would do a different job within the organization. I'd actually go and sit on reception and answer phones and sit with the receptionist because I saw her or him as the most important person in the organization. The first entry into the organization, you had to understand other people's jobs. And given the NHS or within a large hospital, people tend to be very, very focused on an individual component within. If you understand the challenges that other people are facing, you're able to help solve them or assist them along the journey. And I remember playing rugby in Japan and having a tour of the Mitsubishi factory. And we're going through this Mitsubishi factory that was making, they were making air conditioners. And the gentleman that was our tour guide said, we were looking down at a guy putting on the back of the air conditioner. And he said, that's the managing director. He does one day a month. And that's where I learned. And I came back to Australia when I moved on. I thought that's a great idea, just to understand the problems and issues. And one day a month, everybody can give it up just to understand somebody else's business. So the NHS, it's big, it's very, very complex, but understanding the problems and challenges that other people face, it does help.
Andrea, you have worked in the health service here. You're currently in Romania.
Yeah.
But did you have a mentor at any stage, and what did that mentor do for you?
I did have, and I still keep, excuse me, I still keep in touch with him. It's professor of European Public Health, which is an honor for me to have such a mentor. Obviously, we've kept in touch, but not as frequent. I mean, we don't set up meetings as frequently as we did. But he's been a real and great help while I was in the NHS. This is how I learned about how the NHS works and what was the role of public health as a liaison between clinical and non-clinical part of it. And it was actually, it helped in my role because as an overseas public health doctor, as I was seen then, it was difficult. You had to meet all sorts of talking about regulations, talking about HR things and the business as public health working across departments, government departments. So not only with the hospital, for example. So I met also, you know, the three of the issues that David has brought up.
I'd like to introduce Penny because Penny has been working in Warwick. She's a very high-profile consultant in Warwick. Have you had mentors at all, Penny, during your career development?
Thank you, Angus. Yes, I have had mentors during my career, and my advice to prospective mentees, and I can tell you about an experience I have had with my group mentees, actually. But as a mentee, I think I would advise that to choose your mentor and make sure that when you first meet them, actually you understand each other, you draw those agreements as you talked about what the expectations are, and actually make sure that you actually get along. That's really important, and that your values match. I think that's really important. And so I have had a couple of mentors, and I learned from good ones, I learned from bad ones, if that makes sense. And I took the best really out of each one. But if I can share for a bit the experience I have had as a mentor to a group of mentees, actually, which we talked about the one-to-one mentor to mentee, but actually group of mentees can really make the power of mentorship even greater, because you've got a group of diverse people. And not only you can share your own insights and experience, but you can use them to actually exchange learnings from the different organizations that they work at. And the feedback I had from them was exceptional in terms of allowing them time and space to actually have conversations with each other, and then sharing my own experiences on those. And they felt that they grew out of that process, and they became more confident by having actually almost like a peer-to-peer support in that, as well as their own mentor, if that makes sense.
Can I ask you, Penny, your timetable? I've had a wee look at your timetable. Your timetable is horrific. You don't seem to have any time. How do you manage to fit mentorship into what you are doing, or is it now more difficult now that you're more senior?
As you know, Angus, you are a very busy man, and you do things that you're very passionate about, and you find time for things that you are passionate about. And mentorship and developing people is one of my passions, and I always make time for that.
Yeah. Now, Alex, I'd like to get some advice from you because we are a fledgling organisation at UK Digital Health and Care. We have to be very cautious about the way that we develop and not promise too much too early. But I would love to expand our mentoring offering to our members. And I just wonder if you can perhaps guide me as to how UKDHC can do that. We've not got that many people in the organisation. The people who are in the organisation are really committed and they are very happy to be mentors. And we know that some of the people who are medically qualified but running their own businesses are very happy to be mentors for SMEs. But how do you suggest that we take UKDHC forwards? Because I don't want to promise what we can't deliver.
I think it's a really, really interesting one. I mean, you've obviously got, great expertise and commitment and dedication from people. So, but I think, as Penny was saying, it's really important that that connection exists, or that there's people feel the mentee chooses the mentor to have the right skill set for the area they want guidance on. So perhaps thinking about identifying who in the organisation would offer their services as mentors, what their background is, their particular areas of skills. Is it on leadership? Is it on growing an organisation? Is it business? Is it teamwork? Is it, there may be all of those. So people can perhaps choose which areas, or who would be suitable for them. Yeah. Certainly through the webinars, that's an opportunity where some mentors, might get their faces known, or people think, oh, I would connect with that person. In this day and age, we're obviously lucky with Zoom and Teams that actually you don't have to be face-to-face. So we haven't got that as a barrier. But I think, yes, creating profiles of potential mentors so mentees can, see who might have that, be able to help them best.
If I can go to David. David, we've already discussed this aspect of it by going out to our current membership and asking them to volunteer their skills and tell us what their skills are. How should we do that? You've done that sort of thing in your other life.
Well, I think we should just reinforce it. We should go to the membership now and just say, look, those that want to be involved, we're developing a framework. Let's build up your interest, and then go to the market, encourage people to become members. I'm a great believer that, you need to be a member to be part of this program. So that's another part of growing the membership. And that's what we do. We just grow this database, put the people up there, profile them, as Alex has just said. We profile people, start the ball rolling, and then grow slowly. I'm very interested in what Penny said about groups as well. I think that might be a great start.
Because I hadn't actually thought about that, because I was very focused on the one-to-one mentoring, because I think it's easier for people to go one-to-one, but the group mentorship. Penny, can you just give us a little bit more detail about that? Because that was interesting. And you just pack a whole load of people into a room and say, we're going to have a mentorship session.
Well, actually, you don't have to have many people. I mean, it could be, your mentor and two mentees. Between 2 and 5, I think, is a good number. I think more than that, it will be very difficult to manage. And to be honest, the mentees, as I said, is important that they select the mentors. So the mentors, as you said, should showcase the skills, but also the mentees should give something about themselves and what their interests are. And then we match them to a mentor. And I think it works well, actually.
Right.
Let's put our thinking cap on, Angus, and put something like that together to start with.
I think that's exactly what we should do. And
Yep.
I think that in the new year, we will make it very clear what we have available and how we're going to make it available in January and February.
Mhm.
And so I'd like to say thank you to all the presenters, to Alex, to David, and thank you to Andrea and Penny for coming in with questions. I think this has been a very useful session, and I wish you a very good evening. Enjoy yourselves, and thank you for coming.